All right, well, we're going to get started. Again, welcome. I'm Dr. Ryan Doro. Today we have a lecture topic of the top 10 reasons you're fatigued. Before we get going, I'm just going to do a little housekeeping and just introduce you to Aligned and myself, and then we'll get rolling here. So if this is your first webinar with us, welcome. We are happy to have you. And just as an introduction to us, sorry, having a little delay here with my slide. We are Aligned Modern Health. So basically we are an integrated medical facility. And what that means is we have multiple specialties. And why that is, better clinical outcomes. We recognize that everybody's health journey is unique and not one of us are the end all be all. And a lot of people's clinical outcomes are better with multiple specialties. So the branches that are within Aligned are chiropractic and physical medicine. So really putting focus into the why as to why someone is experiencing symptoms. So really paying attention to biomechanical function, improper movement patterns. Another branch is clinical massage. Works really, really well with physical medicine, but also beneficial for relaxing the nervous system, for moving the lymphatic system. And acupuncture, you can see just the list there of numerous conditions commonly treated, just very, very effective at bringing balance to the body and also very effective with the combination of herbal medicine. And then functional medicine, that is my focus of practice. So I will talk a little bit more about that on this slide here. So this is me. And like I said, Dr. Functional Medicine. And functional medicine, I found it best described as really spending the time with an individual to try to get to the root cause as to what's driving their symptoms. And when we say root cause, very rarely is it just one specific thing. And that's kind of like a theme for today's lecture is when we say root cause, we're paying attention to all the things that affect health. Very rarely, like I said, is it just one thing, we find out that one thing and everything unravels from there. I mean, it's usually, okay, like what are the different layers that potentially over the course of these years have led to dysfunction, fatigue, symptoms. So yeah, like I said, that'll kind of be the theme of the conversation today. So jumping in here. So what is fatigue? We're all familiar with it, but the emphasis of today is when it really starts to become something that is interfering with quality of life or day-to-day activity. A little fatigue here and there is normal. But when it comes to the point where, I hear a lot of patients saying, I struggle to get out of bed in the morning, or I need a pot of coffee to get going, or, I could lay down at any point throughout the day and take a nap. But then when I'm at home and it's ready for me to fall asleep, I'm wound and I can stay up through all hours of the night. So it's one of those things, again, it's a clue to say, okay, some sort of imbalance is going on in the body. How can we start to investigate this? And why is this conversation relevant or important? Well, because of the stats you see here, it really can affect productivity. It can reduce quality of life. The third bullet point there is a third of Americans get fewer than 6 hours of sleep. If we're pushing our bodies, that just is not enough time to rejuvenate. And the last one, we'll talk a little bit more about stress, but 77% of people regularly experience symptoms associated with stress. And stress is multi-layered. And again, we will get to that on a different slide here. So again, we have 10 slides for 10 topics. We'll talk a little bit of usable data for each. I'd like people to get usable data from these lectures, like things you can walk away and at least start moving your health or your body in the right direction here. So the first thing, number one, is nutrient deficiencies. And, if you are fatigued, you are unwell, you are experiencing, X number of symptoms, like this is one of the easiest places you can look at to get started. And the reason is, why I really try to emphasize this to my patients, especially, is that, in this country, we are very preoccupied with macronutrients, our fat, our protein, our carbohydrates, and they're essential. Don't get me wrong. We'll talk about those more on the next slide, but we don't pay as much attention to our micronutrients. And the thing is, like, why this is so important is we are made up of cells. Like every aspect of our body is pretty much made up of cells here. So our health is determined by the health of our cells, and our cells run off these micronutrients, and micronutrients are our vitamins and minerals. So you could say, like I just said, our health is determined by the health of our cells. And again, like why that is so important is because our cells are turning over every few months. Like every 3 months, a good portion of our cells turn over. All of our red blood cells after four months have turned over. After a calendar year, about 97%-ish of us is brand new. So the thing is, if those cells are turning over and they're not as healthy as they were before, we start to notice symptoms. We start to notice our hair is not as healthy. Our skin is more dry. Our nails aren't growing as much, if I didn't already say that. We age quicker, so that's why a lot of people notice a difference after taking 3-4 months of some vitamin C, some collagen, some zinc, some omega-3s, because as tissues are turning over, those tissues are now healthier. So really paying attention to that. So some of the ones I bullet pointed here are B vitamins. B vitamins do thousands of things within the body, but this is probably a more common anemia that I see in practice than iron deficiency anemia. Vitamin D is probably the most common nutrient deficiency I see. I mean, we live in Chicago. Vitamin D is our sunshine vitamin. And I'd say almost every patient that comes through the door is suboptimal in vitamin D. And vitamin D, really there is not an organ system function in the body that vitamin D doesn't touch. I mean, that is why it is screened so regularly. It's aids in hormonal health, in vascular health, in hormonal health. I didn't say that. I think I already said that. But and then magnesium, probably the second most common nutrient deficiency that I see. About 80% of the population is deficient. That and selenium, we're really starting to see depleted from our soils. Magnesium, very, very beneficial for sleep, bowel movements, down-regulating the nervous system. Zinc, vitamin C, very good for immunity, very, very beneficial for thyroid health, just like iodine, selenium. So again, like if we're looking at things like thyroid-based issues. Okay, not to say that these are going to be the catch-all for solving the thyroid puzzle, but if you're deficient in some of these nutrients that the thyroid needs to function, this is a place we need to start. And then omega-3, very common nutrient deficiency, probably the second or third common that I see. And omega-3 comes from our fatty fish. Omega-3 comes a little bit from our chia, flax, walnuts, those types of things. But some essential fatty acid, makes up the membranes of our cells. So again, we're trying to figure out how can we make these cells healthier as we turn over. So what are things we can do? That's what this opportunity section is on the slide. It's just like easy, quick takeaways here. So as far as places we want to start, diet is always going to be my number one recommendation. That's going to be slide number 2. Supplements are meant to supplement a very healthy lifestyle. But other places we can start is a good quality multivitamin. And multivitamins are not all, supplements are not all created equal. So when we really take a look at vitamins, minerals, these are things that we want to pay attention to. Highly absorbable forms. We want to make sure we find third-party tested to make sure there's not mold or heavy metals, or that the label is actually what it says it is. So really paying attention to the quality of that. But again, like a multivitamin, if I could recommend one supplement, that is the one, just because it's covering a lot of bases. And if on a day-to-day basis, we're not getting enough nutrients, it's a good fail-safe. Not many people are going to get something like, let's say, scurvy. We all get enough vitamin C there. But at the same time, I take a multivitamin to make sure, hey, at the end of the day, I do get enough vitamin C, not just to not get scurvy, but to repair tissues, rebuild soft tissue, promote collagen repair, those types of things. So again, that's why it can be beneficial. And I see some messages coming in on the chat. We will do at the end a Q&A. So there is a Q&A bubble there too. So if you want to start typing questions, that's completely fine. And then we'll spend time at the end talking about that. And then omega-3 supplements, same thing. That's like a high quality fish oil essentially. And again, like sometimes just the tandem of a good omega-3 or eating more fatty fish or chia flax, like a combination of those can be very beneficial. And then vitamin D. Again, living in Chicago, we don't see enough sun. We have suboptimal levels. We need those between 50 and 80. So this is something that, yes, supplementation is beneficial, but at least running this number once or twice a year, at least with your primary care doctor, to see the range. I mean, you want to be somewhere in the 50 to 70, 50 to 80 range. And the thing with vitamin D is you don't want to go too high because you can go toxic on it. So that's why I write as directed on the bottles. I don't want to give any therapeutic dosages, and it could be problematic for some. All right, let's move on. Next slide here. So slide number 2, diet nutrition. Again, some of these first couple slides are really going to be focused on foundational work. And the thing is, like, if somebody's unwell, they're fatigued, they have imbalances within the body, we have to pay attention to foundation. Because somebody's not eating well, not sleeping well, not managing stress, it's going to be hard to balance hormones or look for heavy metal issues or detox the body from mold. Like all those things don't necessarily matter, or they're more difficult if you don't have a solid foundation because your physiology is not functioning optimally. So as far as diet and nutrition goes, again, really paying attention to micronutrients. When we look at our diet, we want a lot of it to be micronutrients produce 60 to 80%. I usually say is we want the rainbow, the fruits and vegetables that'll give us all these little micronutrients, phytonutrients, antioxidants to really feed us at a cellular base level. But at the same time too, we really do want to, pay attention to proteins, fat, and carbohydrates, because those are our building blocks for soft tissue, muscle, tendons, those types of things. So issues I see commonly with diet nutrition is too many carbohydrates and improper impaired glucose regulation. Impaired glucose regulation or crashing mid-afternoon. One of the top reasons I see for that is blood sugar crashing significantly in the afternoon. So we have food at our disposal in this country. I mean, we can grab pretty much. We're hungry. Most of us are fortunate enough that we can kind of grab anything that we need. And the thing is, processed carbohydrates are one of those easy things to grab. Why that's an issue? Processed carbohydrates would be something like a bagel, a muffin, pasta, bread. And I'm not saying those foods can't be eaten. But when those foods predominate your diet, we run into issues. And the reason is if you take, let's say, a muffin, for instance, you crush it up in your hand, it turns into a dust. Well, that's how quickly our body absorbs it. So we eat these high processed or high, sugary based foods, and we digest them quickly. Our blood sugar skyrockets, and we're okay at that point. But again, we're going to use up all that glucose, and we're going to get this really harsh crash. And some susceptible individuals can really feel that harsh crash. And the body doesn't love a lot of dysrhythmic routines. It loves rhythm. It loves routine. It loves glucose that's just kind of subtly up and down throughout the day. So that's why it is very important when I write here on bullet number 4 is really paying attention to our meals and making sure that we are eating protein, fat, carbohydrates together. I mean, those are all our macronutrients. That's what's going to curb a lot of these glucose spikes. And when we pay attention to carbohydrates, the quality of them, again, you really enjoy muffins, okay, maybe once or twice a week, thoroughly enjoy it. But the foundation of health is not built upon those types of foods. Skipping meals, intermittent fasting is very, I don't know if popular or trendy is the right word. It's not new. I'm a big advocate of fasting. It goes back centuries, and there's definitely benefits to it. And a lot of balance can happen throughout the body. A lot of cellular cleanup or autophagy can happen. So I'm a big proponent of it for most. However, it's not for everybody, and especially long fasts, like 16 or 8-hour fasts where we're skipping breakfast, can be really detrimental to some. We'll talk a little bit more on the stress slide, but at the same time, if we are starting the morning stressed, we don't have time, we're rushing out the door with the kids, we're not eating breakfast, maybe we did a workout, we take a coffee, all these things are stressors to the body, and then not eating or skipping a meal it can just be another added layer of stress. So again, it's about bio-individualizing. It's not a catch-all for everybody, but most people do really well with, let's say, a 12-hour overnight fast. Try not to eat too much after dinner, wait until 12 hours the next day. That can be beneficial. I don't see that cause as much detrimental effects. And then processed foods. This kind of goes, again, hand in hand with exactly what we've been talking about with vitamins, minerals, micronutrients. Processed foods, things that come in bag, boxes, and cans are just not nutrient dense. They don't fuel our body at a cellular level. They're manufactured to taste good. And again, not saying you can't have any of these types of foods. They just can't be the foundation of your health or your foundation of your diet. So things we can start to do, really pay attention to the quality of our food. And quality protein would look like, if it's going to be animal protein, would look like grass-fed, pasture-raised, organic if we can, legumes, beans, hemp hearts, those types of things. Healthy fats are going to be staying away from your hydrogenated oils, your heated plant oils, or not all plant oils, but let's say canolas and things along those lines, and trending more towards trying to get healthy fat with every meal, sometimes a tablespoon or 2, depending on the individual. So that could be some avocado on the side, that could be some olive oil sprinkled on top, that could be some nuts, seeds, things along those lines. And then healthy carbohydrates. Again, carbohydrates, the body needs glucose, the body needs sugar. It's its preferred fuel source, but it's kind of the type and the impact it's making on the body. So if we're trending a little bit more towards sweet potatoes, purple rice, brown rice, your 2 to 3 cups of fruits and veggies with every meal, that's where the foundation of health. If we go around to all these longest lived populations on the earth, the blue zones that they're talked about, this is kind of the focus that the balance they have within their diet. If you're going to be snacking, Again, a little treat here and there is always fun, tastes good, but again, like we have to really pay attention to the quality of our snacks in between and more whole-based foods, and sometimes having that pair between like a healthy fat and protein or a carbohydrate and a protein or something like that is going to really give more blood sugar stability throughout the day. Next is dehydration. This is a quick slide, but something we definitely want to emphasize. The thing is our body is made up of 70-ish% water, and our lymphatic system is the system of the body that moves all that other fluid in our body that is not our blood. And it's about 4 times the amount. And the thing is, if we are not hydrated, our body is more sluggish. We can't move that lymphatic, that lymph is what it's called. And the lymphatic fluid is toxins, is excess cholesterol, is cellular debris. It's like how our body's just getting rid of stuff it doesn't need. And if we're not moving that like lymphatic system effectively, we start to back up. We start to get ill. I mean, the lymphatic system is where we have our lymph nodes. So that's why we can get lymph node enlargement. Those are like our filters of our lymphatic system. So when we're sick, it gets bombarded with the amount of stuff and virus that the body's trying to filter out. But at the same time too, I mean, we just day to day, we can have decreased blood volume, less oxygen and sugar getting to the brain. Our liver, our kidneys, our heart has to work harder. So how we hydrate ourselves is water. I mean, that really is it. As simple as that. But we need to be drinking about half our body weight in ounces of water throughout the day. And not a lot of us are doing that. We might catch up on water at the end of the day, but we try not to drink too much before we go to bed, so we're not urinating all night. So we're going like eight hours overnight without water. Then a lot of us will wake up and have maybe a tea or a coffee, maybe another one mid-afternoon. And sometimes we can get to mid-afternoon and realize we didn't even drink any water. And the thing is, coffee, caffeinated tea, sports drinks, LaCroix, things along those lines aren't that hydrating for the body. I'm not saying those are all bad things to be putting in your body, but they're not what is going to bring hydration. So if you're not a water person, it's just one of those things you got to figure out. Honestly, I mean, this is one of those things that is that important. And it's either adding some things like these pictures show, I mean, adding fruit, adding cucumber, adding berries, things to just give it a little bit of flavor. I could get behind maybe like a sparkling mineral water here and there, some lime or something along those lines. But again, really trying to avoid flavored carbonated water, or at least not making that the foundation of your hydration. Sports drinks, things with artificial sweeteners, paint, colors, like things along those lines. Again, just like don't feed our body or fuel our body at a cellular level and are not as hydrating as water. So lack of sleep, obvious here, but again, a huge issue. Sleep is when we rejuvenate at night. If we're training, this is when, well, not even when we're training, I mean, this is when our tissues repair. This is when our detoxification is at its peak. This is when we're absorbing the majority of our nutrients from our diet. And if we aren't getting good sleep, all those systems become impaired. So we need to be able to lay down, fall asleep pretty quickly, and stay asleep throughout the night. And we need, depending on the individual, anywhere from 7 to 9 hours. I mean, that's really where the literature shows optimal health comes from. So if you're laying there and you're ruminating, you're watching the clock, you can't fall asleep, you're waking up multiple times throughout the night, this is a clue that something's going on. Is it stress? Is it a virus? Is there something going on that we need to really take a look at? Obviously, sleep apnea is an issue. So if you ever have a spouse that lets you know you're snoring or they think you stop breathing, I mean, again, your brain needs oxygen. It's one of its fuel sources. I mean, your whole body needs oxygen. But if you're stop breathing at night, that is a big contributing factor to fatigue. Cortisol, we'll talk a little bit more about on the next slide. I want to emphasize that more next time or on the next slide. And then blue light, we, again, live in a society where we could stay up all night if we chose to. We have electricity, we have the screens. And the thing is, if they're in our face, our body thinks it's daytime, and we can't expect it to then all of a sudden just shut it off and our body then decides to go to sleep. It doesn't work that easily for some. So what are some things we can do about it? Try to focus on getting 7-8 hours of sleep, especially if you're unwell. You feel like your stress resiliency is low. You're noticing hormonal imbalances. Like if maybe it's something you don't think is contributing to it, well, spend a couple of weeks, a month or something, and just say, okay, I'm going to try to get 7 to 8 hours of sleep and just see the impact it makes on your body. Again, I'm not saying one thing is going to be the solution for everything, but we're looking, hey, if you get 7-8 hours, does that remove a layer of the fatigue that you're experiencing? And let's see here, turning off electronics, giving your body some time to at least recognize it's nighttime, keeping the bedroom dark and cool, usually under 70 to 68 degrees is going to be the most beneficial. Make sure you got some breathable bamboo sheets. trying to shut off your Wi-Fi or your router, especially if it's in your bedroom. Some people are really sensitive to that. Develop an evening routine. Like no matter what, if somebody's coming in to focus on sleep improvements, an evening routine is one of those things that I'm establishing with them. Something to help your body wind down. If you're go all day, your cortisol's through the roof, you're stressed, whatever it is, and you can't shut down at night, we need to strategize and figure out how can you do that, because that is effective for stress management and longevity long term. So an evening routine could look like 30 to 60 minutes of reading a book, could be stretching, could be foam rolling, could be yoga, could be Epsom salt soaks, deep breathing, turning down the lights, diffusing lavender oil, and if none of those sound relaxing to you, finding something that sounds relaxing to be able to shut down. Obviously avoid caffeine. Some people can't even go to past 3 p.m. Or can't, that's too late for them. So sometimes even before noon, or just one cup a day would be beneficial. And then breathing, breathing, meditation, effective strategies for sleep and stress management, and supported there by the literature. So chronic stress, this title could be all encompassing. There's so many things that contribute to stress. This, can go hand in hand with hormonal imbalances, low testosterone, estrogen dominance. A lot of times this comes down to chronic stress. So when we think of stress, there's multiple things that contribute to stress within the body. But physiologically, what's happening when our stress is up is we're burning through more vitamins and minerals. So again, like if we're stressed, we're burning through more B vitamins, zinc, things along those lines. We're training, we're doing all these things, we're not getting good sleep. Again, like that's why nutrient deficiencies are a big part of the puzzle. But also too, from a hormonal standpoint, we're churning out a bunch of cortisol. And cortisol is our stress hormone, our fight or flight hormone. It's not a bad hormone, it's just a bad hormone if it's significantly out of balance. So it should be highest in the morning, so we're alert and ready to go. And then throughout the rest of the day, it slowly decreases. So right before bed, it should be low. The body knows it's nighttime, it's going to produce melatonin. We fall asleep. So elevated cortisol before bed is the number one reason for sleep-related issues that I see in practice. So again, like double emphasis on the evening routine, but also paying attention to stress. Like if you're feeling hormonal imbalances, you're feeling low stress resiliency, you're feeling tension, you're feeling more anxiety than usual. It's about really being cognizant of that impact, but also knowing what are the stressors on my body, because it's not always just work stress, relationship stress, family stress. It can be musculoskeletal based pain. It can be inflammation. It can be poor diet. It can be a parasitic infection in your gut. It can be a vitamin D deficiency. It can be your blood sugar bouncing around throughout the day. So again, it's paying attention to all these different layers. And again, lack of sleep. If we're burning our body out throughout the day and we don't get that evening sleep to rejuvenate, these are, again, things we need to take a look at. So what are things we could do? Schedule little times throughout the day to downregulate or set a tone for the day from a cortisol standpoint. So that could look like waking up, going to bed 30 minutes earlier, waking up 30 minutes earlier, and just having time to ease into the day, sip water, meditate, gratitude journal, or even just give yourself more time so you're not rushing out of bed and out the door, because that's going to automatically shoot your cortisol through the roof. Lunchtime, maybe instead of scarfing down food and working and trying to catch up on emails, you actually take a 20, 30 minute, 60 minute lunch hour where you actually sit down and eat your lunch, maybe go for a walk. Again, just if time allows, but really just paying attention to little things. And it can just be 5 minutes of, okay, before I start this next meeting, I'm just going to close my eyes and take a couple deep breaths, like profound effects with just little things like that. And obviously evening routine, very beneficial. Talking to somebody, counseling, therapy, starting to become such more of a common social norm. A lot of people feel like they need to do counseling if there is a diagnosed issue. But the thing is, these are trained individuals to help with coping strategies, ways to recognize these patterns, how to effective coping strategies for stress. So definitely something or someone that is definitely worthwhile to have on your care team. And mindful meditation, again, meditation, deep breathing, extensive research, extensive impact on cortisol and downregulating stress. Number 6 would be food sensitivity. So much different than food allergies. And that's what that first bullet point is alluding to. IgE means those are food allergies. Those are things that most people know they have. They eat something, they get a tingling tongue, they get hives, they get swelling of the face, those types of things. Most people know. Don't get me wrong, there's some underlying allergies that some people aren't aware of, but most people know those. Whereas food sensitivities are going to be in what's known as an IgG response. And these are just different white blood cell reactions within the body. But what's necessary about knowing with this is IgG means it's a latent or a delayed based reaction. So you could eat a food and you might immediately get a reaction, but it could take 24 to 72 hours before you get the reaction. Like, let's say you have a sensitivity to bananas. You have it on Monday, then you have it again on Tuesday, and Thursday you notice you had an eczema breakout, or you have significant brain fog, or again, just more systemic inflammation, joint pain, things along those lines. Those are going to be what's known as an IgG food sensitivity, because it provoked subclinical inflammation in the body and compounded upon itself. So, and this is the number one reason I see for brain fog. And the thing is, like, yes, it is common to see dairy, gluten, eggs, soy, those types of things. But the benefit of actually like food sensitivity testing is I see a lot of people come back positive for oats, for spinach, for bananas, for blueberries. And I really, for most people, wouldn't tell them to stop eating those foods unless they have an actual like true food sensitivity to it. So what are things you can do? I mean, you can work with somebody, you can to do an actual like elimination or rotation diet and strategically try to tease out some triggers, or you do food sensitivity testing. You know, food sensitivity testing is every year becoming more and more accurate, more and more dialed in. The reputable companies are testing your results twice to make sure they're getting the same data. So food sensitivity testing is something most people would benefit from, just to know, hey, what is part of the puzzle that contributes to inflammation? Thyroid issues. So thyroid, obviously, when we talk about fatigue, we cannot not talk about the thyroid. The thyroid is the controller, the regulator of our metabolism. So hypothyroidism is something we see quite a bit in this country. And if your thyroid is slowing down, it means your metabolism is slowing down. So hair growth is less, skin is more dry. Some can deal with constipation, some deal with weight gain, some deal with fatigue, early morning headaches, loss and thinning of the hair and eyebrows. And why this is, again, beneficial is I always call the thyroid the check engine light of the body. And really, if something's going on with your thyroid, the deeper rooted question is why. You know, what started to affect my thyroid? It doesn't usually just start to mess up on itself, even if it's in the genetics. You know, I have a lot of people come in and say, I have thyroid issues. My mom has thyroid issues. My sister has thyroid issues. So it's just genetic, and you know, I need to be on Synthroid forever. And that's not always the case. You know, I mean, if it was just genetics and you just developed thyroid issues, well, why now? Why didn't you develop them 5, 10 years ago? Why didn't you have them when you were 8? You know, so something expressed that genetic predisposition, but what was it that did that? So, you know, I see a lot of, again, nutrient deficiencies, digestive-based issues, liver-based issues, H. pylori, Epstein-Barr infections. Again, all these things can start to shut it down. So it's really worthwhile always asking why, you know, not just, okay, this is off, I'm going to take this medication to solve this. And I'm not saying medications aren't warranted, because they definitely are in certain situations, but one should always still be asking why, like, why not? Why this year did I develop thyroid issues? Why now am I noticing more fatigue? Why now am I gaining weight when before everything I used to do used to keep me at an optimal weight? There's always an underlying imbalance or issue contributing to it. So to monitor your thyroid, there's a lot of markers that give us clues. Most doctors are just going to test TSH. I mean, that's still a good marker. But so if you feel like thyroid is part of the puzzle and you've been tested, you know, TSH has a very, very broad range. It can be anywhere from 0.3 all the way up to 4.5, 5, 6, depending on the lab. But the thing is, if your TSH is creeping above 3, the thyroid's starting to slow down. So if you have signs and symptoms and your TSH is above a 3, like there's some further investigation that needs to happen. And again, why Synthroid isn't always the fix. And Synthroid is just one of the more common medications. There's multiple ones out there. But if your TSH is going up and you take Synthroid, which is T4, which is your thyroid hormone, well, it's going to tell your brain you have enough in circulation, so your TSH is going to go down. However, T4 doesn't really do a whole lot in the body. So Synthroid can be life-changing for some people, but some people can take it and then their numbers look good, but they still feel the same. And that's because low T4 wasn't their issue. So again, when I say in range versus optimal, or TSH is not everything that you need to know, you need TSH, but TSH is a brain hormone. You also want your thyroid hormones. You want to test antibodies to make sure that the immune system is not attacking thyroid tissue. Musculoskeletal pain, number 8 here, musculoskeletal pain, just like with fatigue, a lot of us feel like, hey, I'm in my 30s, 40s, 50s, 60s here. These are just things that I've seen people around me deal with, that my parents dealt with. I'm supposed to be more tired because I'm in my 30s now, or I'm supposed to have these aches and pains. But really, like, again, ask yourself why. Like if it's difficult to put a shirt on because of your shoulder pain, or you can't bend over and tie your shoe because of poor hip mobility or low back pain, like why is that happening? And the thing is, like, if it just goes ignored, it's going to continue to be an issue and it's going to continue to wear out the body. But the thing is too, if you're dealing with all this musculoskeletal discomfort and inflammation, it's persistent stress on the body. It overactivates the immune system, it elevates your cortisol, disrupts your sleep, and then you're in this vicious cycle. So easy things you can do about it. The body's meant to move, and the majority of us have sedentary positions. Like myself, I'm sitting 8+ hours a day here on Zoom or in an office with patients. So you have to prioritize time to move your body because your body is meant to move. And it doesn't have to be exercise you don't enjoy, but you can start walking, moving the body. If you're getting 3,000 steps a day, well, it'd be phenomenal if you could work your way up to 8,000 to 10,000 steps a day. I mean, I can't tell you how many people have really moved their health in the right direction by just emphasizing or prioritizing a day-to-day walk. Obviously, stretching for mobility can be beneficial. Form matters with that. Heat can give profound effects with injuries and stiffness. Exercise, having a trainer, somebody to kind of give you a formal exercise plan. Or at the end of the day too, I mean, just like we talked about with therapists, I mean, there's specialists that specialize in musculoskeletal based issues, chiropractors, physical medicine specialists, physical therapists, really pay attention to movement patterns, biomechanical function. Again, like if you're unable to squat, if you're unable to bend over and tie your shoes, like why? Like where's the body breaking down? Is there a muscle imbalance? Is there a stiffness? Is there something we're doing on a day-to-day basis that is contributing to that? Because the thing is too, if you start exercising and you have improper movement, you're strengthening your body improperly. You're moving your body further in the wrong direction. You're strengthening the muscles that are already overactive, if that makes sense. Impaired detoxification. This is a huge topic and deserves a whole lecture in and of itself. But detoxification is something that our body does all the time. I mean, on a day-to-day basis. And why it is super relevant now is that now more than ever we're exposed to an onslaught of toxins daily. Even before we walk out of the house, before we're even born, they're starting to see this in fetal cord blood. But I mean, this is cosmetics. So parabens, PCBs, plastics, microwaving of plastics, drinking out of plastic, pesticides, antibiotics, growth hormones, heavy metals, but I didn't already say pesticides. So like the thing is, the FDA tests for all the safety of all these things, but we're not really testing for a combination of having 10 or more of those exposed to you on a day-to-day basis. And the thing is, our liver is our main detoxifying organ. All our blood passes through it every 5 to 6 minutes. It's filtering stuff out. It tries to keep up. But like eventually over the course of time, it can become sluggish. It can be overwhelmed by the amount of toxins that it's exposed to. And the thing is, our body's smart. If we have too much toxins floating around in our blood and our liver can't keep up, it's just going to start dumping into adipose tissue. It's going to start storing our fat cells. So that's a lot of times why some people can notice more like puffiness, water retention. They do a detox. They lose 15 pounds in a couple of days. Well, it's not like you lost that much adipose tissue, but you supported your detox pathways and you got rid of a lot of that inflammatory water weight that your body was holding on to. So, we really want to pay attention to that. And obviously, daily bowel movement. Can't tell you how many people come in that aren't having 1 to 3 bowel movements a day. Common I see is every other day or every 3 days or once a week or every 2 weeks. Like this is our liver takes toxins, beats them up a little bit, turns them into water soluble, and we poop them out, we pee them out, we sweat them out, and to a degree, we kind of breathe and huff out some gases as well. And the thing is, if we're not having a daily bowel movement and we're having maybe 1 a week, like all these toxins our body's getting rid of is just sitting in our intestines and we're reabsorbing it and our body becomes overwhelmed. So we need to be at least having 1 good daily bowel movement. We need to be urinating minimum, once every couple hours, needs to be clear, showing that our body's hydrated. And other things we can do, if you're not having a daily bowel movement, try some probiotics, try fiber, try drinking more water, and even like taking that a step further, doing an actual like functional medicine-based detoxes is one of the top things you can do for your health and longevity, is basically giving your liver support to upregulate detoxification and deeper clean your blood. A lot of people are doing this once, twice a year, sometimes every quarter, to just, again, like, not get scared or worried about the stuff that we're exposed to, but just make sure your body's prepared to get rid of the stuff. And last is gut health. You know, it's said that all our health begins in the gut, and or all disease begins in the gut. You know, I could definitely argue that. That is kind of our second brain. A lot of neurons in there. Communication between our gut and our brain is there. That's where majority of our serotonin, our feel-good neurotransmitter is made. That's where majority of our immune system is made, or lies in and around the gut. So common problems I see: low stomach acid. You know, low stomach acid. If you eat a high protein meal and you're belching, you're bloating, low stomach acid could definitely be it for you. If you eat high fat meal and you're bloated, the gallbladder could be an issue for you. If you eat a high carbohydrate meal and you're bloated, low digestive enzymes could be, your issue. But why stomach acid and why we pay attention to that is also our first line defense. So let's say we eat something that has parasites in it. We eat something that has bacteria. And again, like, this is common. We're all eating this stuff. But stomach acid is what kills that stuff, but also cleaves a lot of proteins and minerals from our food for absorption, B12 being probably the most recognized one. But calcium, protein, I do a lot of blood work on patients, and a lot of patients that come in with heartburn, bloating, indigestion, I'll see across the board, B12, calcium, protein, iron, zinc, all running low. And the thing is, like, a lot of times people aren't that deficient across the board and have that void of nutrients in their diet. A lot of times it's just that we're not absorbing. You know, we used to say you are what you eat, but in reality, you are what you absorb. You could have the best diet in the world, but if your gut is not pulling those nutrients in, you're just pooping them out, so really paying attention to that. Next is SIBO, or small intestinal bacterial overgrowth. A lot of people diagnosed with a form of IBS, IBD, inflammatory bowel issues, Crohn's, colitis, but a lot of underlying IBS patients, their true diagnosis is SIBO. If you're dealing with digestive-based issues and you get the diagnosis of IBS, it's not really helpful, right? Like, you have irregular bowel movements, severe distension and bloating, and then you get the term IBS and you kind of realize, okay, now I got a diagnosis, but that diagnosis didn't really do anything for me. So SIBO is something you can really kind of figure out, hey, like, this is underlying what's going on. There's a bacterial overgrowth in my small intestine. Let's treat it so we're not over fermenting. Leaky gut, I want to emphasize some time on this. We're almost done here, but leaky gut, the gut should technically be the outside of our body. We eat foods and the cells of the gut are kind of like bouncers at a club. They get to choose, hey, like, we want you in, we want these nutrients in, we want this protein in, you got to stay here so you're excreted out. But the thing with leaky gut, or what is now called in the medical realm, increased intestinal permeability or intestinal hyperpermeability, basically what it means is the tight junctions of the gut have opened up. So now those bouncers, they're not in control anymore. Things can get into the bloodstream however they choose. And that can be yeast, bacteria, ammonia, amino acids. And this is the top reason for autoimmunity, mast cell activation syndrome, allergies as we get older that we didn't have before. Honestly, like, if you have multiple symptoms, migraines, hormonal imbalances, skin-based issues, allergies, tinnitus, migraines, and you're seeing multiple specialists and really trying to figure out, hey, like, how can I manage this? How can I get to the root as to what's going on? You definitely would look towards the gut first when there's that numerous amount of things going on with how important the gut is. And again, like, if you're dealing with bloating, like, especially a hallmark symptom I hear with patients with SIBO is, I wake up with a flat stomach. By the end of the day, I feel like I'm 3 to 6 months pregnant. I mean, that's a lot of distension happening. That's a lot of fermentation. That warrants some investigation. So things we can do, yeah. Reduce gluten and dairy. I mean, that can go a long way for some people. If you're significantly bloated, hot water with lemon, ginger tea can be beneficial. But honestly, if you're dealing with irregularity, your stool never looks the same, you're not in a routine, you have days without you bloating with this significant distension, I mean, that warrants further investigation. Obviously, eliminating gluten and dairy or drinking ginger tea most oftentimes than not is going to be the catch-all for that. So that's it here. Thank you for joining us. I do have a couple of questions here that I'll pull up and go over. And I'll just leave this slide up for you to take a look at. Really, this is just kind of like the insurances we're in network with, our contact information, and also too, if you ever are interested in more information or meeting one of us, you can always do a free 15-minute consultation. That's basically sitting down with one of us chatting, hey, this is what's going on, and we can give you better ideas to what we do about those types of things. So let's see here. I'm going to go through some of these questions that came through here. So what testing do you use to assess micronutrient deficiencies? There's not one specific test out there. I mean, your traditional blood work can cover a lot of bases, magnesium, zinc, omega-3s, vitamin D, but you can test a full mineral profile in your hair. You can do what's known as like a micronutrient panel, where they're testing actually vitamins and minerals within your red blood cell that screens a good portion of all your vitamins and minerals. There's something called an organic acids test that tests breakdown products in your urine to see do you have enough B vitamins, enough vitamin C. So it all depends on what a patient's looking for. Like if you want as many vitamins and minerals as tested, it might take, you might just run one blood panel or something like that. Allergies, how much do they play a role in fatigue, especially outdoor mold? Well, allergies can be another stressor on the body. Allergies can cause inflammation. Allergies can cause a upregulation of your cortisol. So the thing is, again, asking why. The thing with allergies is what's provoking the immune system. What are some of the things that potentially led to it? Again, like some people might get some mild seasonal based allergies or something along those lines, but this is something that warrants further investigation. If you feel like you have seasonal based allergies, you're always itching, you get chronic breakout with hives, like there's something deeper rooted with the immune system going on there. Good sources of B12 for vegetarians. Our clinical nutritionists would be much more knowledgeable in this, because B12, as you know, comes more so from animal proteins. But again, like your greens are a good source of B vitamins. You'll definitely get some with B12. And again, like you might not need to take B12. I have a lot of vegetarian and vegan patients that their B12 is fine. So that's why testing is very beneficial. Is you can't just say everybody that is on this form of diet or this type of lifestyle needs to take this vitamin. If your B12 is fine, awesome. But the thing is too, a B12 supplement can go a long way. A lozenge, a highly absorbable form of B12. Is food sensitivity testing covered by insurance? If not, how much does this out-of-pocket expense? Food sensitivity testing is not covered by insurance. Food allergy testing, IgE testing is. Food sensitivity testing not covered by insurance. So again, it just depends on the caliber of testing. So, and again, if you're going to do it, I strongly would encourage doing more of like I keep saying a functional medicine based brand, a lab that's CLIA certified, that tests your food sensitivities multiple times to confirm that. So that can range anywhere from a couple $100 all the way up to maybe like $1,400, depending on how many foods that you would like to test. And again, like it's all patient dependent. What is another way to get omega-3 if you can't eat fish? So like I said, you can get it. You have to be more diligent because it's not highly absorbable from plant-based sources as much, or not absorbable converted to DHA and EPA. So chia, flax, black walnuts are going to be some of the highest foods, but also algae. And a lot of my patients that are vegan or vegetarian, or that can't eat fish because of an allergy, you put them on like an algae-based omega-3. So that's always an option, and those are very, very effective as well. What type of foods contain iodine and selenium? Iodine is going to be best absorbed from your sea vegetables. So I'll commonly recommend like seaweed snacks, like just those little sheets, or you can get like nori flakes, nori crinkles, even at like Trader Joe's, things along those lines to sprinkle on top of your food for flavor and iodine absorption. And then selenium, again, vitamins obviously would contain this, but selenium, usually about 2 to 3 Brazil nuts will give you about 200 micrograms of selenium in a day. So good thyroid health would be some seaweed snacks, some healthy fats, and 2 to 3 Brazil nuts. Why is carbonated water not hydrating? Well, not all carbonated water is not hydrating. So like I said, sparkling mineral water, as it comes from the earth, is going to have sodium, potassium, chloride, magnesium, calcium. That is going to be hydrating, even with a little carbonation, not the end of the world here. But like if we're talking about a LaCroix or a Spindrift or a bubbly, the thing is like those have carbonic acid within them, and they have flavor. So the thing is, if it's more acidic, what makes something hydrating is that it doesn't leach minerals. So if we talk about acidity versus alkalinity, a lot of people drink alkaline water. Well, alkaline water is basically water with minerals. So anything that you drink that is going to leach minerals from the body is going to not be hydrating. So again, like if you love a Spindrift or a LaCroix mid-afternoon, thoroughly enjoy it. Like it's not one of those things that's really going to debilitate your health, but like that just can't be looked upon as your water source throughout the day or your hydrating source throughout the day. What about quote unquote healthy processed foods like microwavable lentil stew made with good ingredients, except for sunflower oil instead of olive oil? Again, like everything is so situational based. You know, I would say that most shouldn't be microwaving all of their food, just because it does show that it does denature the proteins, that it can break down the molecular structure, it can pull out a lot of nutrient deficiencies out of the food. But at the end of the day, like if your schedule doesn't allow you to make food all the time and you need to heat up with a microwave, yeah, as long as you understand majority of those ingredients, I would say a nice healthy microwavable something is worthwhile. Like I'm not saying don't do that, but the thing is like the foundation of our health is our diet. And if your schedule doesn't allow you to make and prepare all of your foods, then consider meal delivery or Kitch Fix or something where you can kind of prepare or have these meals dropped off kind of thing. And also too, instead of microwaving, they make a lot of cool like crock pots that are small ones that you can kind of bring in and heat up at work as well. And let's see here, regarding a already answered question, I recently bought mineral drops to add to filtered water. If I add these to my Spindrift, does that help with hydration? Oh, I've never heard that before. That's a good question. Like that definitely would hydrate like a reverse osmosis water or something like that, because that would be void of minerals. And I'm a big advocate of putting pink Himalayan salt. I'm a big advocate of mineral drops to bring minerals into water. But I don't know if I have the exact answer to your question in that standpoint. It would be more hydrating than it is as drinking it out of the can, but I still wouldn't say whatever additives are in that and the flavorings that are in that would still suffice for pure water. But again, like, yeah, I would say if you count on having 2 of those per day and you put a couple of trace mineral drops in there, that's going to be more hydrating than just straight out of the can. Absolutely. So, and I think there was a question on a good multivitamin that I saw pass by. You know, really like look for GMP certified, look for third-party tested. You know, you want to make sure that brands you are buying, like I said, have a third party that comes in and takes a look and says, yes, what they say is in this multivitamin is in this multivitamin. There's not any more or less than what it says in, and that they're highly absorbable forms. So good brands are like Pure Encapsulations, Integrative Therapeutics, Thorne, Designs for Health, Orthomolecular, Claire Labs. There's more that I'm leaving out, but those are good brands to take a look at. So it looks like that's the end. So again, guys, I really appreciate you joining us. Hopefully there were some takeaways. If you do have any questions, I'll leave this slide up here. So phone number and website, you can find all that information. And again, thanks for joining us today. Have a good one.